So, after this fantastic introduction lecture, we would like to continue. Before we continue, and I'm going to introduce Biljana Carevic in a minute, I would like to mention one thing. Later on, we will have a separate session on that. But one of the ideas of the Semmelweis conference is to really get a group of experts together in the entire Central Eastern European region. This is not specifically defined, the region, but it's around 18 countries, 19 countries that participate in or actively participate in this conference and in this communication. And together with Professor Allerberger from the Austrian Federal State Agency, we have started at the last conference to issue a scientific journal. And we have decided to work with the International Medical Journal, Wiener Medizinische Wochenschrift. Most of you will know that it's difficult to see. And 2 years ago, we have contributed participations from all 19 countries regarding the hand hygiene, the hospital hygiene situation, the education, to compare these countries amongst each other. And this year, I'm very proud to announce that we have managed to issue one supplement of this journal on the topic of antimicrobial stewardship in Central Eastern European countries. And we could at least win 15 out of the 18 countries to contribute with articles. And it's a great pleasure that this was possible. And it's the plan that in the future we continue to issue publications that really cover this region, present the data of all countries so that everybody has the chance to benchmark himself or herself against other countries. And this is something that I'm very proud to say. Later on, there will be a session that also gives you the link and shows you some more details about this. But this is something that is really important that I'm quite proud of. Now, let's move on to the Clinic Center of Serbia. Biljana is already there. I can already see her. Hello, Biljana. And Biljana is the hospital epidemiologist and president of the Serbian Association of Prevention and Infection Control. Since 2010, she is working as an infection prevention control consultant to the Ministry of Serbia and Montenegro. And she is a WHO consultant in Montenegro and WHO assessment IPC at the national and facility level. She's in the middle of it, and if we look to the data, we also see that Serbia is going, if you want, into a third wave. We see that the numbers are, the daily infection rates are reaching 4,000 again. The population is somehow comparable to Austria. We are playing the same league regarding people. We are also on an increasing path again. So the situation is quite dramatic. And we are really looking forward to your lecture experiences of COVID outbreaks and learnings for the third wave. Biljana, please.
I would like to share with you my experience with outbreaks, healthcare workers, the group that had been, can you hear me?
Yes, absolutely.
Okay, so I can't share my presentation. I tried to go through the share and try to find my...
Can we open it here? No. Just a second, we will open it from here.
Okay. So Didier Pite has a very great, as always, a great presentation and mentioned a lot of things after presentation that is really important. And as you mentioned, we had a problem here in Serbia, and 4,000 people per day is pretty much. And this is not as the rest of country in Europe have the second wave. We are faced with the third wave of COVID infections. what also is a big problem, because I'm working in hospital and I'm dealing with problem of hospital acquired infections, and one of them, unfortunately, is also COVID infections. We faced with the problem that many colleagues have been infected. And when Monica invited me to present my experience, the first what I decided to do is to talk about that, how many colleagues have been infected, and if there is differences from the beginning when we had a little or small number of infected people in the country, and what is the reason in November and December this year why we had so many colleagues infected also in hospitals. And I just want to continue, but I need the slides. So this is the slide that I like very much, and from the beginning I use them because this is what we have seen from the end of December, and what was happened during the next 4 months. And in April, it takes 4 months for COVID, for coronavirus, to get 1 million. The first million is the hardest to earn, so that is what happened also with coronavirus. So we had in April, we had the first million of people, COVID people. After that, or if we looked at the moment, we have 110,000 millions of people who are COVID infected. So we really know, the next slide, from the beginning that we were thinking about the way of transmission, and what we know now is that it is airborne transmission, but also on the slides you have some stuffs presented, because in the hospital, much more important than in normal life is that the contact, because you may have the other wave of spread of this coronavirus. As I am an epidemiologist, in next slide, also I am using this slide because, as I said, as epidemiologist, I am looking on the problem in this way, that where we have environment and contact pattern and cost factors and socioeconomics. And also, if we are looking, it is more highlighted in hospital than in another facilities or another organization or at home. So we know that healthcare workers are more exposed more usually, and the duration of exposure is bigger than anywhere. So the healthcare workers are exposed and in higher risk to get infected. So in the next slide, I just put that from the beginning, staff from my department, we are dealing with the problem of healthcare associated infections. We use the slides that have been published by WHO or CDC, and we organize the training on to the training of nurses and doctors and all other staffs, how to safely put on or put off the personal protective equipment. And we also survey how they do that, because we know that could be the way how they could infect it. So we also, just to remind you, from the beginning was talking about how safe the using the mask, and after 4 weeks WHO has published that wearing the mask all the time when you are on your duty in hospital is very useful and is very well recommended. The next slide, this is the free next slide with the pictures which I have taken from other, not mine, hospitals. All hospitals from the world has the same pictures putting on some net. And my question is, when we are talking about how to prevent spreading of coronavirus, I just want, and I am asking myself, is it really possible to work 8 hours or 6 hours with these very sick patients and make not one mistake? That was something that I really wanted to answer, because my colleagues are very tired. And when I am talking with them that they have to use all protective equipments, said that they are doing that. And it's really, you will see in my results, no one from intensive care units was infected. Persons who are working in intensive care units were not infected by COVID. So where did they contract the infection? That is the second question. And what is the most risky procedure which leads to COVID? As Didier mentioned, it is the procedure which produces aerosolization. Yes, it is. But is it real in the real life that only the person who are working that procedure are infected or not? And this is my next slide. This is my University Clinical Center. I just put 3 pictures of them, 4 pictures, because just to show that, to say that we are not in one building, 23 clinics and about 7,000 employees are working in clinical centers. So it means we have a clinic for several surgical procedures, surgical specialists, and other clinics for internal medical medicine. So 3,600 beds we have, but in different locations. So I decided to show you the next slide, what we have in 3 of 23 clinics, what we have. I'm leading the infection control prevention in these clinics. So I decided to show the data about what happened and who and how these healthcare workers infected. So we have 2 different slides where I have show you that we had noticed the outbreaks, and I choose 2 of clinics or hospitals who are surgical and non-COVID hospitals. So in clinical center we had only 2 hospitals which were involved in treatment COVID patients. So this one, this slide is the results of outbreaks which happened in July and August. And we have in July, that was the second wave, as I mentioned, and this is the surgical hospital where young patients are coming, young adults, and in July and in August, the outbreaks started from COVID patients. What happened in that time? Happened that the recommendation for admission the patients in hospital was changed, so PCR was not obligatory for admission. We asked, at that moment, we asked the patients to have blood tests, serological blood tests. So if antibody is negative, it means this is not infected patient, so could be admitted. but it was not good because that patients a few days later had the symptoms infected, because there are always in that unit there are together. We do not have two bedrooms or one bedrooms, each much more beds in one room, so patients were infected and spread the disease. And also one doctor and 4 nurses was involved in first of outbreak, and in second you can see 9 patients and 1 doctor and 2 nurses. What happened in January? January was also the time where we have a lot of infected people, so the numbers are much higher than before. So also the patients was admitted and was in the incubation period, and spread between them on that unit. So we had 9 patients and 2 nurses involved in these third outbreaks. On the other side, I would like to show you how many in this clinic was doctors and nurses infected during this 1 year. And you may see that out of outbreak, we have 11 doctors and 38 nurses who has been infected. So if we look the numbers, how many employees in that clinic we have 115, 20 doctors, 17 nurses, and non-medical staff 25. And as you can see, 65% of employed doctors were infected during this first year, and 66 nurses, which is much higher than you will see we had noticed in COVID clinic. The another one, next slide is about outbreaks in another non-COVID hospital, also surgical hospital. And we also had in June, during the second wave, in June and July, the outbreaks in different wards. So in June, what happened that patients were admitted, was PCR negative, but later on it was happened that in operating room, 1 anesthesiologist, 1 doctor, and 2 nurses were infected because the day after operation she got the symptoms, and she was PCR positive, that patient, and she was hospitalized in the room with 2 and other patients, and both of them were infected. So in June, that was really something that happened during the operation, and the anesthesiologist was infected by her. And in July, in other words, we also had started from the patients also, but was the reason was that it was the patients without any symptoms, and doctor and nurses contracted the infection from them. In November, you will see, and in December, you will also see in this clinic, this staff has been sent to help in another COVID hospital, which was opened in November, late of November, and they have been there sent to help and to work 1 month with COVID patients. And 1 nurse of them, which came back to the hospital, she was the first positive one, and starts from that moment the outbreaks which had. But if you have looked, you will see how many in next slide, how many in November and in December also we had how many colleagues were infected, and unfortunately in November, one of nurse which were infected not in hospital but through the social events. She has been hospitalized and died. And if we looked in the next slide from this hospital, out of 295 employees, 37% of them in this year were infected. This similar is with doctors, not similar, but 53% of doctors have been infected during this year, and 33 nurses. And the next slide is from COVID hospital. As I mentioned, this is a hospital, this is the clinic which from time to time has been involved in treating the COVID patients, and that was in April and May, and during that period was registered two epidemics, two outbreaks. The first one was when we had 11 healthcare staffs involved in this. That was 4 doctors and 7 nurses. And this is, they treat the COVID patients, but I have to say that the first positive nurse was not infected by during the job. She was infected from her husband, and it really was happened that the nurses who worked in the same shift, and 2 of them are also transporting by the same private car, was started from them, and we had 7 nurses and 4 doctors who have been infected in this outbreak without connecting with infection patients. In May also happened the similar situation, but now we had 1 non-medical staff, and this was something that also has the similar explanation. In November, they wasn't involved in COVID systems, so we had involved I put 9 persons who has been infected, and we had that outbreak, but that was something that was the similar explanation that I have said, that hospital which has been open for COVID patients are organizing on the way that from our clinical center, every clinic have to send some percent of employees to work there. So some of these nurses was there, and on returning with symptoms or without symptoms, but not recognized what have mentioned the epithet. The most important is to think on COVID, not to think that it is something that you usually have. It is my headache, it is my allergies. Just when you have any symptoms, just think that it is. Just check if it is COVID, so it means do the tests. And if we look what happened and how many of staffs are infected through the social contacts out of the hospital, we saw also that we can see that more doctors and nurses have been infected through this waves, especially in November and in December, when we had so many transmissions in population. And the last slide of this, this is the result, the same that we have, and this is something that is that we didn't expect. The COVID hospital has the less numbers of infected 34% of doctors and 50% of nurses. Yes, it is higher percent, but it's just less than we had in surgical non-COVID hospitals. So instead of conclusion, something that maybe was already mentioned by Didier. The problem is that it's been going on for too long. Healthcare workers are very tired. It requires to change the way of life, and this is the hardest what humans have to do, to change the attitude and the way of life and way of thinking, acting. The other problem is that we need to produce enough vaccines, which we see that we do not have enough, and to vaccinate as much as possible. And also what we need is to exchange results, thoughts, experiences as fast as we can, and also to publish that, and also to just to fight with the rumors of what mentioned Didier. And also, which is very hard to expect, is that healthcare workers must think positive. Sooner or later, this will be behind us. But as I said first, it's lasts too long. And the last what I would like to say is we need to take care by ourselves and to be prepared to struggle with post-COVID manifestation. And first of all, for this group, for this conference, I think on us who will deal with problems of healthcare-associated infections who are caused by multi-drug resistance organisms. That will be something that we will do in next months for coming.
Thank you. Thank you very much, Biljana. Here is my applause. You did a great job presenting this situation and comparing the different hospitals one to each other. You did a fantastic job telling us that everybody is exhausted, but also telling us that we still have to keep going. It's not an easy situation. And I was very touched by the idea that, of course, healthcare workers, they have to wear all these safety equipment and safety masks 6 to 8 hours and not make any mistake. This is something you totally underestimate. And I'm very glad that you mentioned all these things. Now there is a couple of questions in the chat, and I would just like to read the first question to you. Was there a difference in COVID and non-COVID hospitals, how the staff used protective clothes and masks?
Can you please repeat? I didn't hear you well. Something happened with my
Not a problem at all. The question is, was there a difference in COVID and non-COVID hospitals, how the staff used protective clothes and masks?
I'm not for if we are talking about the outbreaks, there is not differences between how they use and how they put on or put off, but unfortunately, the most of these outbreaks happened during the breaks, because during that time they just eat together, have breakfast or a coffee, and usually that is a small space where they're sitting, and they are not wearing the mask. And that was the reason in the first 2 waves how they infected. But during the November and December, the reason why we had so many and again outbreaks, it is because of the many people, many healthcare workers had some symptoms, but they didn't think about that and come when they lost smell. That is 4 or 5 days later. So during that period, the pre-symptomatic, they worked and infected other colleagues. Even we have enough tests, even we are very well organized and we test a lot, that was happened.
This more or less answers the second question. The second question, how is the availability of tests and other important protective material in Serbia?
Yeah, we had. That was very good. We had enough.
Fantastic.
At every moment, not only at the beginning in March, but we didn't have in March any healthcare workers who has been infected. Only one, I say, but that was in...
Then we have 3 more minutes and there are 2 more questions. One question is, thank you for the interesting presentation. What was the compliance with personal protective equipment use amongst the healthcare workers? Was there any misuse, like double gloving, lack of hand hygiene, reuse of masks, etc.?
No, I for these outbreaks, which I choose to show and share with you, the reason was not how to use the protective personal equipment. The reason was that when they are tired and use the outbreaks, they have been infected. That was happened.
Thank you very much. And the last question here is, Dr. Carevic, do you think herd immunity is reality with COVID-19? If yes, at what is the level of morbidity which can bring us to the herd immunity?
I think that at the moment, maybe you know that we have 4 different vaccines available here in Serbia, and we have started in the late of December with immunization, and pretty good. For example, I mentioned that we have 7,000 people who are working here and more than 4,000 people, healthcare workers and others, employees in a clinical center is already vaccinated. If we add the people who have been infected plus them, I hope that we will have a good situation soon here in hospital, but also have to mention that we experienced that some of completely vaccinated professions have been infected when they have been in close contact with family members who are positive. And we are collecting the data about how they look. That was, we are very satisfied that the infection is asymptomatic in that people. But what we have on a national level, that is less than 80%, I think that it will not give us the bad time. More than 80%, I think.
Yeah. So this is still some time and some way to go, but this is pretty much in alignment what other epidemiologists say, that herd immunity before 70-80% is not a real option, and so we have to keep on struggling. And thank you again for this very good observation that you performed in these different hospitals, and analyzing exactly each outbreak and trying to get these things under control. And we keep all our fingers crossed that you can continue positively in Serbia, and that you get the herd immunity as fast as possible, as we all hope. Thank you very much, Biljana, and goodbye. Thank you.